Hear me? Okay, perfect. All right. This is, as I said, this is our first time, so we're going to roll with it as we can. So I'm really excited to invite a bunch of panelists to join us today to answer your health and safety questions. As I said, this is the first of what we hope will be a series where we are going to bring in different experts to answer questions specifically designed and generated from Starbucks baristas, but we hope that this information will be useful to folks in a lot of different workplaces. And we want to answer your questions about what your rights are in the workplace, related to COVID, but other issues too. Coworker.org is not affiliated with Starbucks, and I am not a lawyer, and this is not legal advice. We're just here to help answer your questions. Coworker is a nonprofit organization, and we're here to help people organize in their workplaces. Over the years, thousands of Starbucks baristas have started and joined campaigns on our petition platform and won important improvements like paid parental leave, changes to the dress code, all kinds of other changes too. So we're excited to be able to support Starbucks baristas in getting together and taking collective action to improve their workplaces. So without further ado, I will start to invite our panelists. We're really excited today that we have two panelists, Al Vega and Mark Catlin, who will be answering all your questions. And I'm going to let them in right now. All right, here's Mark. Welcome, welcome.
Thank
Great
you.
to see you.
Good to be here.
And let's see if we're... All right, and we just sent Al his invite too. Okay, and so just to keep the conversation going. Welcome, Al. Awesome to see you. All right, cool. So just a quick background on our two panelists here. Mark Catlin is an industrial hygienist who has assisted workers with occupational health and safety issues for 40 years, so he really knows what he's talking about. He retired in 2018 as an occupational health and safety director for the Service Employees International Union and currently volunteers as an advisor for National COSH. And National COSH is the Council for Occupational Safety and Health. We dropped a link into our bio for this organization, so you can check out that link and find out more information about the organization and connect with folks who are part of the national network in your area as well. We're also excited to have Al Vega here. He's the Director of Policy and Programs of the Massachusetts Coalition for Occupational Safety and Healthy. For over 20 years, Al has worked primarily in the nonprofit social justice field with a focus on using workers' safety and health to engage all workers to become more empowered in their workplaces. And he's on the board of National COSH. All right, so we're very excited to have you. And we asked Starbucks baristas ahead of time to send us some questions that they have about what they're experiencing in their workplaces. We got a lot of responses, a lot of great stuff. So we definitely want to dig into that. But just to get started, we wanted to kind of get on the same page about what are the terms that we're talking about, who are the players involved, and what's the context right now. So I'd love to just start off with a really general question. Couldn't get more general than this, which is, how would you define workplace health and safety? What does it really mean?
Great. Thanks so much, Tim, for having us. And I'll let Mark chime in after me. But, when we think of workplace health and safety, I think a lot of people assume it's, just an agency or some abstract thing. But workplace health and safety is something everybody should have when they go into a workplace. The idea that you are working for an employer, but that employer's responsibility is to provide you with a place of employment that ensures your health and safety, whether that be your physical health and safety, your mental health and safety. There's a lot of things that come in that you need to consider when talking about workplace health and safety. But at least in this country, that's the idea, is that there are kind of laws or regulations in place in terms of what is supposed to be happening in your place of employment. Mark, I don't know what else you want to add on that.
Yeah, I would only add what most people think about when we talk about workers' safety and health. They think of the federal agency called OSHA. And that's one piece, one tool. And it's actually 50 years ago this year, Congress passed the OSHA law that basically said, as Al was talking about, that all workers in the U.S. have a right to a safe and healthy workplace. And the employers have the primary responsibility to make sure that gets done. So that's really the basis of our OSHA law in this country for 50 years and still today. But there's lots of other pieces, as Al mentioned. We'll talk more about that: the role of unions, the role of workers, and others. So.
Right.
Yeah.
Yeah.
On that note, I mean, I'd love to hear. National Coach is obviously a great resource and an important part of the picture. And you got the laws in paper. Now you got to implement them. So I'm curious if you could tell me more just about the origins of National Coach and the work that you do.
Sure. Yeah. So as Mark mentioned, back in the early 70s, the OSHA Act was passed, and so organizations like MassCosh started forming around the country. I believe the first one was in Philadelphia and in Detroit or Chicago. I think those are the two first COSH groups, and there used to be a lot more COSH groups in the approximately 25 there are today. But the idea was that we wanted more than this law to just exist, you know, as part of an agency or on paper, but to be able to start to disseminate information about the law, your rights, training, how to actually use the law in depending on what type of industry or sector you were in. And so organizations like ours were started primarily by union activists, which, you know, we had much more abundant numbers back in the day. MassCosh is actually also represented by the Steelworkers Union, as you can tell by the logo on my shirt today. So that's one of the kind of interesting histories of the kind of National COSH network, is there is a lot of union involvement and activism that kind of helped to start a lot of that work. And Mark definitely has a lot of expertise in that world as well.
And a lot of unions have been working on different health and safety issues for around 100 years. It's kind of a core labor issue that often isn't recognized. People look at wages and benefits, but conditions of work and safety and health are incredibly important to many work sites. And I think more, and we're seeing that now today, this year with the pandemic, where everyone is facing threats from the pandemic in every work site.
Yeah, and you know, I'd love to dig into that, which is that, you know, a lot of people might have, you know, workplace health and safety might have been an issue, but it really went to the forefront in the past year, of course. And now bring us up to where we're at now. What is the opportunity? Obviously, there's a change in administration. What's the context now? What does that change for workers? And before you get into that, I do see a question in the chat about, can you ask a question? And yes, please do add questions into the chat in the comments as well. We might not get to all of it. This is going to be a series, but we will definitely take note of it and try to get to it.
Yeah, so when I think obviously, you know, if you've all been following federal politics, the last 4 years up until early January were, I would say, a bit tumultuous and very anti-worker when it comes to what our federal administration was doing in responding to worker health and safety. And so I do believe that, you know, the incoming administration, the Biden administration, has put workplace health and safety at the top of their list in terms of priorities. They've already taken some additional measures, which I'm going to let Mark chime in on to talk a little bit more about the ETS. But I do believe that the fact that there is an OSHA that's realizing they need to really respond and do absolutely the opposite of what I feel was done over this past year when it comes to workplace health and safety is an opportunity for workers to really raise these issues and actually get some response from OSHA, where in the past, I think there was a little bit of skepticism on where that might actually lead.
Yeah.
So, Mark, I don't know if you want to talk about the ETS a little bit, what that means.
Yeah, I will. I mean, it's really been tragic for those of us who've been doing this work a long time. This past year, where we've had you know, thousands and thousands of workers dying from COVID directly related because of their work, both in healthcare, in food processing, and like with Starbucks and others. So we don't know how bad it is because the last administration really didn't collect the data and really didn't want to do anything about it. But with the new administration, one of the first things that President Biden did was issue an executive order that said OSHA would look at whether they should issue what's called an emergency temporary standard, which is a really unusual act where the agency moves very quickly to set a standard for protecting workers. And we're expecting by the end of March that OSHA will come out with a standard that will be temporary, but it will be a start to protect workers from COVID. It will require all employers that are covered by OSHA, which we can talk about, to assess the workplace, what the hazards might be, how workers could be protected from it, and then actually do that protection. And if they don't, workers will have an avenue to file anonymous complaints with OSHA. OSHA will investigate and force employers to do this.
Yep. And again, this is very different, in terms of what we saw a lot of over the past 4 years. It was tons of rollbacks and barriers to actually pushing for more protections. We've obviously been on the forefront of trying to think about what else we can be doing to protect workers. And in the last 4 years, we've literally had to use our time to save what was already there and fight to make sure that it didn't get worse. And unfortunately, as we know, this pandemic has exposed where there are tons of gaps in areas where our government needs to do more to keep people safe when they simply want to go to work and make a living.
Yeah. At the same time, the other opening is the labor movement will have much more opportunities under the new administration, not just under OSHA, but under other aspects of labor law and other agencies that will give organized labor more tools to use to push for better conditions for their members, and hopefully to organize workers who are really pissed off by how they've been treated in this last year.
Okay, great. Yeah. And then just one more question before we dig into some of these amazing submissions from baristas. There's a lot to get into, and I'm excited for that. Give us a snapshot about, like, in terms of where we're at now and what we know about COVID and transmission, what are the things that baristas specifically might want to be most concerned about? Mode of transmission, ways of protecting themselves, what should be top of mind?
I'm going to let Mark answer this one first. Go.
Yeah, this has actually changed from the beginning of COVID. When COVID started, there was a big focus on that it was spread through touching and contact and surfaces. So everyone started cleaning, disinfecting, hand washing. The CDC now believes that that's a much less important route of exposure, and so it's still there, but probably overkill right now. The second route of exposure they thought was what's called droplet spread. That's when people sort of cough and sneeze in your direction, and so that's where this 6-foot distancing came about. But what we really know now since the summer is the real way this disease spreads is through the air in enclosed spaces that don't have good ventilation. So if you're inside a space, unless it has very good ventilation, and that doesn't mean just open a window or put a fan on and let it blow around, but really good ventilation, that's primarily how people are probably getting exposed and this virus is spreading. So the issues of not just keeping people 6 feet away, not just disinfecting, but it's really this issue of thinking about about the air in the space that you're in and everybody in that space who might be spreading COVID, because it's spread asymptomatically. So people aren't coughing and sneezing, but even talking and just breathing puts droplet microscopic virus particles into the air that can linger and be viable for hours. And this is the real issue now, and the CDC is really struggling with how to think about this. But OSHA, we hope, will address this better in their upcoming standard on what employers have to do. But it's a real paradigm shift in thinking about infection control from where we started.
Yeah, and I think the only other thing I would add here, Mark, is I think unfortunately, as much of a good thing as the vaccines are rolling out, I don't think they're rolling out in a way where people all of a sudden feel like, let's get rid of the masks and forget social distancing, because the percentage of people that are actually vaccinated versus those who are not is still very big. And so I don't think we have to let up on a lot of these measures and mitigation efforts that we've been pushing, for the last few months, over the last year. And it's really sad to know that there are states and governors who are kind of taking their authority to kind of decide, I'm going to reopen the state up, kind of a full reopening, and then just let businesses kind of deal with a one-on-one kind of issue when it comes to trying to keep their employees and the public safe as well. And so I think these are the kinds of things that people need to be aware about. As much as we're hearing about that coming out, we need to be concerned that people are all of a sudden thinking it's okay for us to not be masked up and stop social distancing, because that is going to lead to a rise in transmissions if all of us start thinking that way.
Yeah. And it's really not clear yet that even if you're vaccinated, it might be possible that you can still spread the virus to others.
That's true.
The vaccines are not 100% effective, and so even if you've been vaccinated, there's a chance you might still get sick. It's much lower. And then there are these variants that are coming in, like from South Africa, but the ones from Brazil especially, where the vaccine may be less effective, and people who've had COVID, one of the earlier variants, might get sick again. So there's a lot of unknowns here. So in that case, we take the position that employers need to continue to protect their workforce, continue to protect workers until we know better. We need to take a precautionary approach and not just assume things are okay because that's easier.
Well, this is a great segue because this is also top of mind for the baristas who reached out to us before the Q&A. So we asked people for their questions, and some of this does relate to the question that I see in the comments, so please stay tuned. And definitely reach out to Coworker, reach out to National Kosh with your specific questions as well. But the top issue that came up was masking policies, and specifically it was about the difficult position that baristas are in when they are the ones who are having to enforce the policy and monitor customers' compliance with it, and the potential that that sets them up for abuse from customers and all kinds of issues. So I'm just going to read two quick comments that relate specifically to the issue you were talking about as well. We got a comment from someone from Mississippi that says, you know, Mississippi just lifted its statewide mask mandate. However, Starbucks still requires customers to wear masks. This morning, a customer blew up at the shift supervisor because she wanted him to wear a mask, but he believed because the state no longer requires face masks that he didn't have to. And then one from Texas. Texas opened the state 100% and lifted the mask mandate. We need to feel supported when it comes to the continued requirement of wearing masks in our store and not allowing dine-in at cafe stores. So curious if folks have thoughts on that, like, you know, being in that position as a barista, what can you do? What should the employer be doing?
Yeah, so I think, you know, Mark and I have talked a little bit about this, and I think one of the things that we know at the end of the day, as we mentioned, it is an employer's responsibility to keep their employees safe at all costs. And so what that means is, regardless of what a state is doing in terms of saying it's okay for you to be out in public and in other places, but when you go to a private establishment, that establishment business can have its own policies in place, which include having a mask to, you know, be inside this space, get service from our employees. And so it is kind of important for the tone to be set by the employer. So I know how hard it can be for an employee to say, please keep your mask on, if the supervisor is saying customer is always right. But the customer can't always be right if they're putting your workers' safety and health at risk. And so that, I think, is the main message, is that private employers still have a right to keep their workers safe. And so if a mask mandate is what that employer wants, it doesn't matter what the state is saying you can and can't do, because it's different once you're inside that place of business. Mark, what else would you add here for that particular question? Oh, did we lose Mark?
Can you hear us, Mark?
Oh. I think we may have lost Mark for a second there.
I think it's getting situated, you know. It's a new thing, this Instagram Live.
Yeah,
okay,
no worries.
Run into the next
yeah,
one.
the only thing I guess I would add here is that, you know, obviously, as you'll keep hearing from us, that it's obviously much easier to bring up these issues if you can do it in a collective way. Mm-hmm. So if you're not the only person that's raising this, if you're able to get your other coworkers to bring forth these demands, it's much harder for an employer to say or single you out and be like, everybody else is fine, I don't know why you're the only one complaining about this issue. So it does become easier when you have that collective action. And obviously a union would be the best way, because you might have a contract to go to, but being able to do things collectively can sometimes get the kinds of demands you need.
Cool. All right, that sounds great. And then, so another big theme that came up a lot in the questions was, and this is something we've been hearing for years from baristas, that people are frustrated that they feel that their stores are understaffed for the expectations of the job. So if you take a situation where people felt their stores were understaffed, then you're in an even more difficult situation now where there are new responsibilities expected of you. That can create a lot of problems. So we got a lot of questions about that, specifically, you know, what do you do if your store is understaffed? How do you keep the store sanitized and do all those kinds of things? Just going to share a couple quotes. They cut our hours so we have less people on the floor to help sanitize and clean. Another quote, why are we not supplied enough labor to deploy partners to control the amount of people who enter the store related to social distancing? Another one, we are all becoming overworked, exhausted. We work shorthanded very often. And then it's hard to keep an active person on sanitizing when most of the time it's busy and not staffed enough. So sometimes it's great, certain things are on paper. Staffing levels might make it hard to implement those safety protocols. So I'd love to hear more about, what could be done there. And Mark, can you hear us? We could.
Yeah, looks like
No?
it sounds like this connection went silent. I don't know if Mark, if you can hear us, maybe to log off and rejoin us.
Yeah,
But
we'll let you
I will
back
do
in
my
again.
best to kind of keep us going. So in terms of this particular question or area, in terms of staffing for us is always a key health and safety issues. We know so many incidents in workplaces occur as a result of not sufficient staffing, overworking staff, people not having enough rest time and making mistakes. And so, something that might be an initial way to kind of assess what's happening in terms of the hazards that you're all facing is to do what we call is a workplace hazard assessment. So literally mapping out your workplace, mapping out all the different roles, the number of specific tasks that are needed in certain parts of that workplace, and then using that assessment to actually then show your employer, if you're asking us to do all of these tasks and jobs, we only have 4 people, but you can clearly see there are 6 separate jobs that are necessary over the course of one shift. What can we either stop doing so that we can cover 4 things well, or can we bring in additional people to support the other 2 work areas that we need in order to run this business under the current conditions? Because we know, you might need somebody at the door who could be ensuring that people aren't coming in without masks. You can have somebody that's doing the sanitizing more frequently if that's something that you want to push for. That's one thing that Mark and I talked about, is that at the end of the day, there has been a lot less transmission that it's done by surfaces, and so we are over cleaning and over sanitizing. So even beginning to kind of scale that back down might be something to help with being able to do all of the tasks needed. But I think at the end of the day, you have to be able to show your employer, manager, that you're being asked to do all of these things. How can we do all of this in a timely fashion if there isn't sufficient staffing to do all of these things? And hopefully that might get traction to change what you need to have better working conditions there.
That's a great suggestion. And welcome
Mark,
back.
you're back.
Great time.
Mark,
So-
have you been hearing it at all?
I
Yes,
was,
I don't know if you.
yes. And I would say that like the answer to a number of questions is if you're represented by a union, you have a lot more options to fight those kind of problems. Basically,
collective action. Yeah.
it's managers having you do their job, and so you can push back on that and have management do their job, and let you do your job.
That's great. And, so I think we have time for at least 2 more. Let's just do 2 more quick ones. And I'm seeing in the chat, this sense of kind of like, managers have different incentives, hard to get people to pay attention. This is another one that I think is kind of related to that idea of policy on paper and what does it take to get it actually implemented. Paid sick leave comes up a lot. A lot of baristas are meant to have access to paid sick leave, but they say they have a lot of problems actually securing that and taking the time off. So there are people who say, if you can't find someone to cover, this is a quote, if you can't find someone to cover your shift, they make you come in regardless of how you feel. Another one is when people call in sick, that's okay, but they're helping keep others safe. But what is not okay is keeping the store open and working normal hours. If we lose a few partners for the day, why don't we close early? Someone just straight up asked, why are partners held responsible for covering their own shifts when sick? So this is the idea of they have access to paid sick leave, but then it becomes really hard to actually take that leave. What can a worker do in that context?
Go for it, Mark. I'm going to let you go ahead and respond.
Well, it's there may be depending on where their location is, there might be sort of wage and hour laws that could help them there. So I would say they should check with coworker and national cost to find out if there's any local enforcement that might help. Certainly, we don't want people coming to work sick during this pandemic or anytime. If this was a regular flu season, we don't want people coming to work sick and spreading the flu or any other diseases. So again, there may be some language in the OSHA emergency standard that will address this, that employers have to assess workers and can't allow you to come there sick. And then a defense would not be, oh, the workers couldn't find their own replacements. That's a management job. And so that would, we're all human and we all get sick and we all work. And so
Right.
an employer needs to plan for that. And so, the other again, I fall back on, if we have situations where workers in unions have had to face the same issue and they can fight back. Okay? You can fight back through various collective bargaining and other means to force the employer to come up with policies that make sense.
Mm-hmm. Yeah. Yeah, no, I think this is definitely another area that we know at the end of the day, nobody should be asked to be, paid extra because they're to sacrifice their health, basically. But we do believe there should be an attempt to properly compensate people for having to work in more stressful conditions. And so the idea of hazard pay is something that we are always a little careful about because we don't want it to be incentivized as a way to say, if you're willing to hurt yourself, we'll pay you a few extra dollars. And so that's not the mindset, but definitely compensating people for having to work when a lot of other people can work from home or have, much limited hours and still get the compensation that they need for their families. So keeping that in mind.
One more question I want to get into, but that also made me think of a resource that I think I've seen. It was new to me, but I saw Kosh put it out. That basically it's kind of like a list of different ways to remove the hazard from the workplace. And do you know what I'm talking about? It's like a graphic.
Yes.
Could you
say
a little bit about that?
The hierarchy of controls. Yeah. So I'll briefly, the hierarchy of controls is kind of like a pyramid. If you think of the food pyramid, that design, it's the same way, but you look at it in terms of, protecting yourself from at the best level, which is basically removing every possible hazard so that you can continue to do your job without needing the other layers of the hierarchy. So the other layers of the hierarchy are use of personal protective equipment. Sometimes it's policy. It's specifically writing policy to ensure that certain things aren't being done to put workers' health at risk. It could also be, Mark, help me figure out what's the other one I'm forgetting.
Well, the one that I would think of, because it's my profession, is ventilation, engineering.
That's right.
Call engineering control. So having proper ventilation in a work site would be one way. It's not something you can do as an individual worker, but it's something your employer has to do. And so, but that would actually be the first approach I would want to see an employer take. And the last approach would be having you wear something on your face to protect yourself. But in the pandemic, we're doing all these things because there's lots of unknowns.
Yeah,
exactly.
Okay, cool. I'm thinking one more question if folks have time, and then we'll wrap up and let folks know how they can stay in touch and keep asking questions because we got a lot to go through. So there's so much more that we could do. Okay, so the last one, I'm going to talk about the drive-through. So this is a really interesting issue, and thanks for that link too, Michelle. So the drive-through is interesting because it's kind of that hybrid space of you're indoors but you're outdoors. And so a lot of folks have talked about how the customers often don't wear masks when they're driving up. But people who are working the drive-through are still getting really close to them. And even at the height of the pandemic, when baristas organized and they got cafes closed with pay, they still kept drive-throughs open. So it's been going on. Here's a quick sample of some of the questions that we got. How can baristas stay safe at the drive-through window? Most customers do not wear masks and are a foot from our faces. We're supposed to maintain conversation and make connections. So, the employees are judged on their customer service here. So what's the deal with that situation? What should workers do? How should they stay safe? What should the employer be doing?
Yeah, I'd say it's again, what should the employer be doing? And so I think one thing I think that would be interesting is if there's folks out there who are working at Starbucks and their store has figured this out or has a good solution to let you all know at coworkers so you can spread this around. One thing we find really helpful is workers often have really good ideas that management, if they're listening, can implement and solve a lot of these problems. But some of the things that I've thought of or seen is certainly there could be temporary barriers against the open windows that would minimize the air contact between the barista and the customers, because the customers are only there for a minute, so they don't think it's a big deal. but you're there seeing
Right.
scores of customers in a day and getting all that exposure. So it's an important, real issue. There are also some drive-ins that have done things like windows that close, and they have outdoor shelves so that the window is open. You put the food out there. You close the door before the customer comes up. And then the last one I thought is a really interesting engineering control, which is drawers, pull-out drawers that are filled from the inside and then open to the outside, which allows for the transfer of product, but no contact between the worker and the customers, and that prevents all sorts of prevents exposure. So there are out there.
Yeah, and I would say kind of using the hierarchy of controls kind of concept, ideally what you should do is there should probably be all kinds of signage from the moment you reach the drive-through saying, in order to get service at this particular Starbucks, you need to have a mask the moment you come to the drive-through window. And if you constantly repeat that, a customer can't say, oh, I didn't know I was supposed to wear a mask. But again, that has to be on the supervisor, the manager, to enforce that from the get-go. It can't be on each of the baristas to have to tell people you're supposed to be wearing a mask. That has to be enforced by their supervisors. It's very difficult to get anything enforced unless you have the backup of your coworkers and your supervisors.
And your union when you have one. So
yeah, and a union is always a good thing.
I mean, it really is an issue in a lot of work sites where if the supervisors don't back up their employees, they're faced the wrath of customers and others. And so it's really important that whether it's a hospital or Starbucks, that the supervisors and the employer back up their staff and protect the staff, and don't just leave them out there to face whatever, somebody angry in the public who's had a bad day who you have to now face. So.
Yeah.
Sounds like that's happening.
Workplace violence. Yeah, workplace violence is another issue we didn't talk a whole lot about, but that is the kinds of things that can lead to workplace violence if there aren't measures put in place to help prevent that.
And I want to say specifically that's a theme that we're hoping to pick up in a future session as well. So,
And workplace violence is the major reason women are killed on the jobs, just because of the jobs women have. So it's often takes place in settings that we don't normally think of as being violent. We think of male occupations, but threats by customers are considered violence. Where you might feel threatened and at risk, that's violence. People may throw things at you. People may physically assault you, or they stay afterwards and they catch you leaving after the shift. So there's a lot of elements to workplace violence, and only a few states have passed actually good laws and regulations to try to prevent that. It's a major area that needs work and safety health.
All right. Well, so I'd love to hear just some what's your take home advice for anyone who's tuned in so far, even though we really scratched the surface here. But two themes that I'm hearing a lot about that I really like are, that people really need to be sharing best practices, talking with each other, talking with coworkers, talking across workplaces too. That's really exciting. And I also love that I've seen some of that happening in the chat of people being like, let's connect about this and that. So that's what I love to see. And then of course, the other thing is organizing and working collectively as workers to make sure that the employer is being held accountable. Love those themes. And I'd love to hear just some closing comments from each of you.
Yeah, I think you hit it right on the nose. I mean, that's at the end of the day, we believe that every worker deserves to go to their job and return home in the same condition that they started their day. Our country was not created simply to have some people have to sacrifice themselves so others could benefit from society. And so that's what I would say is no matter what role you have in terms of a worker, you should have those rights. And so don't give up hope. I know that there's a lot of things that people face on a day-to-day basis, and this pandemic has exposed us to so many more things. But I do believe that we're in a better place where we can ensure worker health and safety for anybody in this country. And so connecting with organizations like us through koshnetwork.org, or finding out if you have a union. There might be a local union who's trying to help organize and you want to get more information. We're more than happy to do that. And coworker.org is definitely a place where you can begin to learn a little bit about how to best move forward with some of those things. Sure. Mark, did you want to add anything?
No, I think you're just right. I think
nailed it.
you know, organize and bring unions into your work sites. That's the very best thing you can do to on a whole range of issues, including safety and health.
Yeah. Right. And if you can't get to a union yet, worker centers and other worker safety and health advocacy organizations can provide those resources, training, and support as well too.
Yeah.
Yeah, if you go to Coworker, we do have some like frequently asked questions and some guides and tips and stuff for starting the process of organizing and working with your coworkers. So definitely check that out. Well, this has been amazing. I wish we had so much more time, but we are hoping that this becomes a series and it's not just a one-off. Lots of questions to get into, so I'm really excited to keep the conversation going. To anyone who's tuned in, please keep sending your questions to Coworker and to National Kosh. We have a link in our profile to National Kosh. Also, the website is just nationalkosh.org, all one word.
Mm-hmm.
Okay, got
National
it.
Kosh.org.
Perfect.
Or Koshnet, either one, yeah.
And they're on Instagram too, National Kosh. That's great. And so yeah, and also, I mean, you know, shameless plug, but please do follow Team Coworker on Instagram because that's where we'll post updates about future sessions and sign up on our email list as well. And yeah, I'm just really appreciative to everyone who joined in. We didn't get to all questions, so that doesn't mean we don't care about your question. Please get back to us, and we do want to hear from you. And I'm really appreciative to both of you for the work that you do and for taking the time to chat with us on this new platform with technical issues and all it comes with, but we're happy to have the conversation.
Great. Thanks so much for having us.
All right, cool.
So much,
Thank you so much. Have a good night, everyone.
All right. Have a good night, everyone.